you guys may already be familiar with some of this, and you obviously are since you had 5 years of working with sleep. So, and there's lots of, I mean, I'm going to put a sleep packet together, and it's going to have all the tips of sleep hygiene, but there's lots of things you can do. So I may not name them all right now, but areas of sleep hygiene are things like you can take a hot bath in Epsom salts, which has magnesium in it, magnesium and sulfate, which is really good on the joints and the muscles. It helps you relax. You can actually take magnesium as well if you need it. I take magnesium with my vitamin D, so I absorb it better. There's all kinds of things like getting screen time out of your face, making sure your room is really cool. You want it at least below 65 degrees. I have no heat in my room up here. I open the window even if it goes down to 20 at my house. Just put plenty of blankets on. You want your body to be warm, not too hot. You don't want to be too hot, but you want the air around you to be really cool. You want it to be as dark as you can get it. Make sure there's no, lights on your clock, lights on, this or that. Light coming under the door. You want it to be really dark. So those are some really easy things you can do. Some people like white noise, like a little bit of white noise, which can be really helpful. Earplugs, eye covers can be really helpful to people. So there's a whole lot of things. Things like doing activities in the morning, really heavy activity, and exercise should be done earlier in the day. Getting sunshine is super important. Taking vitamin D early. So these are a whole lot of different things. Don't take vitamin D in the afternoon. Take it in the morning. And it can help with sleep because we normally get sunshine early in the day. 10 to 2 is a good time to get, but earlier than, like dinner time. Don't take your vitamin D at dinner time. So you definitely want, several of those things. Some people say eating 2 or 3 hours before bedtime can help us sleep better because our food typically is out of our stomach. There's not as much activity. It can help with reflux, things like that can really hurt sleep. So there's a lot of sleep hygiene activities that you can do that can actually improve your sleep. And what I usually tell people is you may have to do all of them. You may have to do a lot of them to get what you need, including, other sleep remedies that we're going to talk about. But not all of those, but I'm just saying you may have to do a lot of these activities. They say have a ritual every night before you go to bed exactly at the same time or as close as you can, get up at the same time every day. Try not to nap during the day if you have sleep troubles at night. It doesn't mean napping's bad, but try not to nap if you have sleep troubles. And then I have issues with some of my little older folks who don't know that they've slept, or they don't feel like they've slept, or they don't do very much activity and they nap often during the day. Then they don't sleep at night, and then they feel like they're up and alone, and it's dark and there's nobody around. And so, sleep cycles can really get off, especially as you get older. So those are some things that I try to talk to people, educate people on is sleep hygiene. And another thing is that that affects sleep hygiene is weight. So if we're obese, we don't sleep as well. And so diet can be a big deal, which is high carbs, decreased sleep, increased hot flashes, increased fiber they have found, and healthy fats can actually make your sleep better. So, and that really goes along with all kinds of disease and illness, our diet. So, and then the last two things we haven't talked about on sleep hygiene, caffeine and alcohol. So if people really struggle to sleep, I say completely cut out caffeine. Do not drink it. Because for some people, even though they drink it early in the morning, it still affect their sleep at night. So do not drink caffeine if you have trouble sleeping. And a lot of people drink soda all day long, Dr. Pepper, Mountain Dew is horrible with the amount of caffeine that's in it, and those types of things. There's even some green teas and different types of teas that have a fair amount of caffeine. So you got to cut out caffeine, especially no energy drinks or anything like that. And that may be why some of our young people are struggling to sleep, because they don't think about it. So caffeine's a big deal. And then the last thing is alcohol. So some people believe, and it may be true, that resveratrol in alcohol, it may not be enough in wine or things like that. But a lot of people may drink some alcohol, some beer, a little or wine or other drinks. Even 1 or 2 drinks helps you get to sleep, but it can wake you up 3 to 4 hours later, and then you can't sleep well. And it's because of receptors in our brain. So I won't go into the physiology of all that, but if you have trouble sleeping, don't drink alcohol. Don't drink it before bedtime. You know, if you had one maybe at lunchtime, a glass of wine or something like that, it may be okay. But just consider it may be causing you sleep problems if you drink it later in the day, at night. All right. It's not per se, no, it's not for sleep. It's, you know, it's supposed to be good for us. It is good for us. I think I talked about it for dementia and for other things. But people drink wine because of resveratrol, so they may do it at night. So it's more the drinking wine that can be the problem for sleep.
And the irony is that their lack of sleep is going to send them into that cycle sooner than if they weren't trying to get the resveratrol.
Yes. So it's not...
Just drink wine in the day.
Yeah, there's but there's problems with grape juice because grape juice, grape juice may not be your answer because it has too much sugar, huge amounts of sugar. So, so I don't recommend grape juice for your. Yes, there's other ways to be healthy. We don't have to drink wine to get the resveratrol. There's lots of other things we can do. But just letting you know that lots of people realize, think about resveratrol and they drink wine because of it, and that can hurt their sleep. So just, So the next thing that we're going to talk about are, now we're getting to supplements and then herbs. And they're mixed a little bit, so I try not to, but I tried to separate them. But so these are the things, and how am I doing on time? I don't know.
10:26.
When do I finish? Okay, yeah. I always have to speed up towards the end. So, and this was mentioned a little while ago, melatonin. So that's the first thing on my list. So melatonin is definitely very helpful for sleep, and it can help our sleep cycle and our, we have our diurnal variation. If people have second and third shifts, sometimes they can take melatonin. If you travel and you get out of a time zone, sometimes melatonin can help with that. So these are some interesting things about melatonin. We take anywhere from, a lot of times, 1 milligram to 15 milligrams or more. So our own body makes melatonin, up here in our pituitary or whatever. We make melatonin, but we don't make 15 milligrams of melatonin. So we may be taking too much. So I tell people to start literally maybe at a half a milligram and see if that's helpful. And you may need to do it for a few nights to see if it works. So it may not, you're not just going to suddenly feel real sleepy and, when you take it. So melatonin actually comes from the daytime activities and the sun and so forth, or starting early in the day, and it increases as we get ready to go to sleep at night. So, and it starts in really small amounts and then it increases. So I will tell people, start with 1 milligram, a half a milligram or 1, and then gradually creep up. Now, the side effect of melatonin that we have to remember is it can increase depression. So you got to be careful with melatonin if you already have depression. It can increase the depression. Another really interesting thing about I wouldn't call that interesting, that's not all that great, but an interesting fact about melatonin is in Europe they use it as birth control. But they take it in very high doses, 75 milligrams. And these hormones, like I said, all work together, and it literally can keep you from getting pregnant when you take it at higher doses, really high doses, and that's what they use. Not everybody, but they have used it there. It took me forever to find out the dosing on that. It was 75 milligrams or above. So that was very interesting. So anyway, so that's what you want to think about with melatonin. Melatonin is a substance you can use with other things. So it doesn't interact because we have it in our own body. You have a question.
Yes. Can melatonin become addicted to it?
Typically not. Not that I'm aware of. I stop people immediately.
I know they can't sleep without it, and they've been stuck on it for like 2 years.
They can get used to it and not sleep without it, but that doesn't really mean addiction.
Does it reduce the receptor size? It take a lot of melatonin to reduce your receptor size.
I'm not sure. It's possible. It could. I haven't.
Your own cycle, though.
Do what?
Does it mess with your own ability?
So it might because of the amount you're taking. Yeah. The amount you take may have a factor in not being able to do without it. Not because you couldn't get to sleep in the first place is why you're taking it. So,
Does it interact with testosterone?
I don't know. I know there's going to be an effect because all these hormones affect each other. But I can't say, it wouldn't be an interaction, but there's going to be an effect.
Yeah.
Okay, that would be much more.
Separate paths.
Yes, absolutely. Interaction is not quite the right word. So, so when I have elderly that I've got on melatonin, I've stopped them immediately and there's no problem. You know, it's not like they're withdrawal or anything like that. So that would be more of an addiction type thing if you had withdrawal, but there's no withdrawal. So we don't have to worry about weaning off typically. And I typically don't put them on huge doses. The only time I did was in COVID. I started out doing it that way because that's what was recommended, 10 milligrams of melatonin. It made my elderly so sleepy. Everybody thought they were so horribly sick with COVID when they weren't. Couldn't eat, they couldn't do anything because they're like, and I'm like, get the melatonin, stop the melatonin or get it back down to 5 or 1 milligram. I put them way back down because my recommendations at the nursing home were 10 milligrams. And it was like, it's killing my little old people. So we took them down and then they were lots better. I had one who just couldn't stop sleeping and they thought she was super sick. Stopped the melatonin and she was fine. So, and they had COVID. So and as physicians, most physicians don't use these a huge amount because they're more supplements. So we don't know. So here we go. We tried it. Whoops, that didn't work, So you have to make sure to follow your own body, think about what you do, see how it makes you feel, and try not to overdo anything. Think about more physiologically what it does in our own body. And we really that's where I say herbs, supplements, and all of that are still a pill. We want our body to naturally do things if we can get it there. And of course, this day and age, it's very difficult. We have so much. It's a big picture. It's always the big picture. And I always look at the big picture, but it's hard to change everything to get your sleep right. And sometimes you just have to have sleep, and then work on the big picture. So sometimes we use these pills and supplements and so forth to get the big picture taken care of later. So, but I want you to know that that's, as a practitioner, if any of you guys are practitioners, that's the way you want to think. You want to help everything, or for your own health. Look at everything. All right. So, Inositol. So Inositol, we got the grinder again. Inositol. So this is a sugar alcohol, but it's part of our cell membrane. So we have lots of this. It's abundant in our brain and elsewhere. So it helps regulate hormones. And it does this because it helps neurotransmitters. It helps neurotransmitters bind to receptors. And it also helps take messages from the cell wall to the nucleus. So I do know some of the physiology behind this one. But it's actually made from glucose in the body. And the kidneys actually help make 2 grams a day. So we make our own inositol. It's found in organ meats and leafy greens. And it's really needed, it's very important for the proper function of serotonin. And we've already talked about serotonin being really important. We make it while we're sleeping, and it helps with pain, so forth.
In other words, more salads, better diets, when they come in hospital, you can sleep better.
Yes. Yep. So, and we found in depressed patients, it's decreased in the CSF, your, the words are going away from.
Your cerebrospinal fluid.
Yes.
Gotcha, Mama.
Oh my gosh, thank you.
It's
Cerebral
the
spine. I know, cerebral spinal fluid. I know what CSF is. That's good.
Words are hard.
And so we already know that depressed patients have either too much sleep or not enough sleep. So, so inositol can be really helpful. It's a sweet powder, and you can mix it in a liquid, and kids love it. So the dosing that's recommended is 1 to 6 grams, either 2 or 3 times a day. And what it does is it can actually help with stress as well. Sleep and stress. The one thing you have to be careful of as a side effect is it has a laxative effect. So it can give you some GI upset. So you guys may or may not know this, but if people eat a bunch of diabetic candy, it has sugar alcohol in it, you will get diarrhea. You be careful with your kids giving them sugar alcohols like in, diabetic chocolate.
Pre-workouts are all of them, and that's like a common thing in the gym. It's
Yes.
like, oh, you get the low in
Right.
or before your workout.
So you have to be really careful with sugar alcohols. It's in chewing gum. It's in a lot of different things. So just beware. Okay, another supplement is theanine. It's an amino acid, and it's mostly in the tea plant, almost exclusively. L-Theanine.
Which tea?
Oh, and I got just black tea, I think, and just regular tea, yeah. It increases GABA and dopamine. So GABA kind of helps us relax a little bit, calm us down in the brain. Dopamine just makes us feel kind of happy. So it promotes alpha waves, and we didn't talk about alpha, theta, and beta waves, but these are waves that our brain goes through in our sleep. So, and it's non-sedating. So this is non-sedating, which is good. Decreases blood pressure and anxiety. It's neuroprotective and non-toxic. And your dose is 100 to 800 milligrams per day.
So is there anybody that you would not recommend L-theanine for? Is that something that like is pretty much would be good for anybody that has a sleep problem? Or is that used in presence of certain
So we make,
factors?
so we make some of these in our own body. But if you're having trouble, it's something you could try.
That's
At
what I'm
this
saying.
point,
Is there a
no,
group
I
that
don't.
You would say I
No.
would not try this for?
Yeah, I don't think so at this moment. And I don't typically use all of these. These are things that I would like to. I use some of them,
Yeah,
and I
try
wanted
these
you. Yeah, I wanted you to know about these amino acids, and we're going to talk about a supplement that's got even more amino acids in it that helps with sleep. So I don't use these singly or individual, at the moment, but I'm working on a sleep packet to help people so that we can try different things, and it's something they could add to what they're doing or that kind of thing. Yes, and that's in my, it's coming.
Wow.
Yes, it's coming. So I got to go a little quickly, so what I may do is get you to write your questions down, and we'll do them afterwards because we're going to run out of time and I don't want to mess up the next class. But so glycine is another amino acid. It's a non-essential amino acid. It's inhibitory in the brain and spine. And I won't tell you the mechanism of action on every single thing of these, but so you can take 3 grams at bedtime, and it decreases your core body temperature. And you remember I told you we need to have a lower body temperature. Phosphatidylserine, and I know that's a big long word. Phosphatidylserine. Try to spell it. I'll help you later. It's a phospholipid, and it's prevalent in our neural tissue. So of course our brain is full of neural tissue, and it helps decrease cortisol. Okay, so we're not so wound up. So our dose is 1 to 300 milligrams a day. And then another supplement that we can do that I already mentioned quickly is magnesium. And it's a cofactor in over 300 different enzyme systems in our body. So it's super important for a lot of activity. And it's strongly, a deficiency of magnesium is strongly correlated with sleep problems. So 2012 trial, 500 milligrams for 8 weeks, increased sleep time, sleep efficiency, decreased cortisol, increased melatonin. And it also helps with vitamin D absorption, which also we talked about helps with sleep in the morning. Your dose is 1 to 400 milligrams a day. I've read in some instances that soaking in the tub and getting it through the skin is better than taking it by mouth. I've seen other things that say not, but either way, I think it's a good way to get your magnesium in. So there is a supplement, you can get it on Amazon, called Super Amino Night. And it has L-arginine. Just put Super Amino Night down because you can go look it up and see what's in it. But it's L-arginine, L-lysine, L-ornithine, L-carnitine. It also has some vitamin C, B6, and chromium picolinate. So my partner, who's struggled with sleep forever, can take these. He has trouble taking, he takes melatonin and he takes this. And it really has helped him sleep for the first time, and he's 56. So he really has struggled with sleep, and he can't take the sleep medicines. They do crazy things to him. He sees aliens. He went nuts on Ambien the first time he took it, and he saw aliens for 3 nights in a row, even though he took it once. And he was afraid to go to sleep. I don't know what color they were, but he was afraid to go to sleep. It was so vivid. And it stayed with him for 3 nights. So you have to be careful. And this works for him. They're huge though. They're really big, and you take 1 to 4 of them. And he takes 2, I think, sometimes 3. So they're big. So that's, one of the things about. Okay, the next thing we're going to do is herbs. Uh-oh. Okay. Oh, I got a little time. Okay. Herbs and other therapies. So there's 2 different things you're going to see, a couple of different things you're going to see about people who have sleep trouble. They're either tired and wired, or they're too tired to sleep. They're just so wound up and they're too tired to sleep. Or another thing they can have is an A-type personality. So typically, you think about nervines when you're thinking about this too tired to sleep. And you can use B-complex, massage, baths, like I said, yoga, and some other herbs that are good for this. And this is a general category. I'm going to talk individually about each herb. I'll have to go quickly. Avena, Melissa, chamomile, lavender, and centella. That's for the too tired to sleep. And there are others, but and then you have your type A personalities, which are they can be anxious, irritable, restless. They can have hypertension, teeth grinding. People who are really A-type. Nervines and sedatives and anxiolytics are good for them. Calming are things like glycine, magnesium, inositol. And then you do want to avoid valerian in these types of folks because it's a more heating herb. Ashwagandha you may also want to avoid. And Piper M, what is that? Piper M, you know what that is? That was also mentioned as a heating herb. Okay, well anyway, that was mentioned. I don't, like I said, I don't know the herbs as well. So ashwagandha is a adaptogen, a nervine, and it can help you restore your circadian rhythm. So that's what I kind of like about the herbs. They've got specific purposes where Ambien and all the others don't. We just knock people out.
But
These
ashwagandha would not be good for your A-type.
No, it's not, because it's a heating herb.
Got it.
So, but it does, it does not work quickly. So you have to remember that it takes time for ashwagandha to work.
Quickly, like within the frame of a night? Or
Yes,
frame
you
of
can't
days?
just take it and go to sleep
Okay.
that night. It's
Okay.
going to take, days to weeks probably to get your circadian rhythm where it needs to be. I haven't worked with it in that way because it's hard for me to test somebody's circadian rhythm and, those types of things. So I just want you to know if people are struggling with those things that they'll tell you to a degree, they may know or they may not know, but you have to ask a lot of questions to get information out of people to try to figure out those types of things that are going on. But this is also a GABA agonist versus antagonist. Agonist means it helps. Antagonist means it fights against. So it's an agonist. So this does help with anxious folks and ADHD. So, but 1 teaspoon to tablespoon and per dose tincture. You guys may know a lot more about tinctures, but 2 to 8 mLs 3 times a day. You can do it in capsules as well. I'm not crazy about tons of capsules. I prefer tinctures and skin and all other other ways and teas and things like that because you can get so many. You can take hundreds of capsules and it's very expensive and that kind of thing. But anyway, okay. The next thing is lemon balm. You can grow this in your garden really easily, which is nice, and it's the mint family, Melissa officinalis. It enhances cognitive function, increases mood, decreases anxiety, and improves sleep quality. Okay, so it probably helps. I can't say this for sure, but it may help with non-REM and REM sleep, which means your REM sleep, you're doing your cycles properly, hopefully, and it's helping with that. It also improves attention, focus, restlessness, and hyperactivity.
I'll take it with the thyroid issue.
Don't take it, you're saying. Okay, thank you for telling me that. So do not take it with a thyroid issue.
It's great for ADHD.
Yes.
Lemon balm tea, it's gonna be-
And if you guys know the doses, do you want me to tell you the doses?
Yeah. Yes.
Okay. So it makes a great tea, 1 to 2 teaspoons dried in an 8 ounces of H2O. Tinctures, 3 to 5 mLs. TID, 3 times a day to 4 times a day, sorry. QID, TID.
Yeah.
And then you can do a dried herb, 300 to 1,000 milligrams TID. Okay? Oh goodness, I gotta fly. Holy basil, which is Tulsi. It increases mood, mental clarity, improves sleep quality, helps normalize cortisol, decreases anxiety, and I think, didn't you say it like knocks you out, Miss Suzanne? Yep. Yep. Enhances dopamine and serotonin. So this is good for people with, depression, serotonin issues. Your dosing is 1 to 2 teaspoons dried 3 times a day. Tincture, 3 to 5 mLs, TID to QID. Lavender, like the others, it's a mint family. Tea, teaspoon dried, 8 ounces, and it has some of the same characteristics of the others that we've just been talking about, helping with relaxation, stress, and you guys may know about lavender. There's different ways to use it, though, that are really helpful. Tincture, 1 to 3 mLs, TID to QID. QID is 4 times a day, by the way. Capsules, 80 milligrams, BID, and then topical or pillows and inhalation, which can be really calming. So we tried to do it in our clinic to de-stress people, but nobody liked the smell for some reason. It was in an infusion.
Pair it with lemon and it's so nice.
Yeah, maybe we need to do that. We did not pair it with anything. And they love the citrus smells. They like the citrus smells, so we've done those. So, okay. And it does say pairs well with other herbs.
Lavender's like the ultimate helper.
Yeah. Yep. Chamomile is a nervine for irritability, restlessness, difficulty falling asleep. So this one, that's why they say chamomile tea. I've had a lot of people say it doesn't help them in my clinic, but I always recommend. So this is where I'd say, okay, do a few things. Do that along with some other things that may, and get into a routine. And
turn your phone off and pay attention to how it actually
works. Yeah, exactly. So this can actually, it's good for children. And so your tea is 1 to 2 teaspoons of flowers. And tincture is 2 to 3 mLs, QD to, which is once a day, to 4 times a day. And then you can do capsules, 350 to 700 milligrams. I may mess these words up. Scutellariae? Scutellariae? Huh? Scutellariae. Scutellariae. Right, which under I have skullcap. Latifera Latifera. I got to learn how to say these words. Okay. And skullcap, I always use the the common names. Blue skullcap is also of the mint family. So, and this helps with hot flashes. It's a nervine, antispasmodic, mild sedative. I don't know if this would help with restless leg, but it may because it's an antispasmodic. And we have to deal a lot with restless leg. But yes, and there are other things that can, but anyway, it's a mild sedative. It's good for tightness. When people, neck tension, headaches, when people are like, oh, like this, because they're so stressed or, whatever. And my own partner's been like that. He's just like, So I have to find something, massage and everything to get his shoulders to relax. A tincture, 3 to 5 mLs, 3 times a day. And I don't have it listed in any other ways except the tincture. So kava, it's a pepper plant. Piper mephisticum. That's the, anyway.
It makes an interesting moonshine.
Yes, I've analgesic, antispasmodic, anxiolytic, sedative. It tastes awful by itself.
Yes, it does.
I take it with other things, and it's not so bad. It does definitely promote sleep, relaxation without decreased mental cognition. So that's really important. And the tincture is 2 to 6 mLs, QHS, which means at bedtime or at night, at bedtime or before bed. And I always, so these next 3, that one and 2 more, I use in a tincture. I actually buy it from Hawaiian Farm on Amazon. I may start getting it from our local folks or something similar, but purple passion flower is in it. And it's, this is for people who excessively worry, purple passion flower, or overworked. So somewhat for the type A personality. A tincture is 1 to 3 mLs, 3 times a day. And then valerian, it smells like dirty socks, I tell people that. But I think it smells more like molasses a little bit, and tastes like it when I do the tincture. So it actually mixes with the kava and the purple passion flower to taste like molasses to me, or a little bit weird molasses, but anyway, so I can take it with the valerian in it. muscle tension, sedative, hypnotic, increases GABA, you know, the relaxation, control, and this is in controlled studies. It shows valerian's helpful. So, okay, and I didn't have that down. Okay, I'm getting close. Mimosa, that's the one you mentioned. This is albizia, julibrisum, mimosa. So this you use your bark in flowers. Tree of happiness. It's antioxidant. It's a nervine, antimicrobial, and anti-inflammation. And we'll talk a lot about inflammation at my dementia talk. It's a gentle sedative, and it's hepatoprotective, which means your liver. Yes. So it really can help your liver, or protects your liver, and it's a mood lifter, obviously, if it makes you happy. So what it does is, I haven't spoken about 5-HT, which I will in a minute. It's a receptor. This is good for the 5-HT receptor. That's a precursor to serotonin. And so, and I'll tell you in a minute, you can actually take 5-HT as well, which can help with sleep. Decreases mental chatter, you know, those, used for irritability and anger or deep grief. Tincture, 30 to 90 drops, once a day to 3 times a day. Okay, and then quickly, sleep helpers. I'm just going to fly through them. Oh, that's it. Okay, I have extras.
Tincture real quick, what'd you say?
30 to 90 drops. Once a day to 3 times a day. Sleep helpers, CBD, anxiety and nightmares. It helps with that. THC. It's not available yet in Alabama, but it's been medically cleared by the Constitution here.
Yeah,
not Constitution, but
right.
Who can do it where? Yep. Medical in Alabama. No clinics yet. PTSD and sleep. That really, really helps with PTSD. And then the extras, 5-H, and I'm just going to read them, 5-HTP and or L-tryptophan, Jamaican boxwood, GABA and GABA promoting supplements, I don't know, I have nutrients. Oh, promoting nutrients. Phosphatidylserine and curcumin, which comes from, anyway, so those are all some extras. All right, I think that's it. Any questions? Now we can do questions.
Someone that has issues just sitting down and not falling asleep, whether it's in front of TV, somebody speaking, a voice droning on, they don't have problems sleeping at night, but
that can be narcolepsy, and so I don't know the herbs because I'm not an herbalist, but stimulant type herbs would probably be good for that. Okay. Caffeine, can help keep some people awake. And it may depend on the reason, because medications can do things like that. It's not normal for people to fall asleep in the middle of the day unless they're super stressed. Does she have a lot of stress? Super busy? Overdoing it?
I'll check on that.
Yeah.
It's just like you can see it on her. She'll just start falling asleep.
Yes. So
in front of a TV, in front of somebody talking.
When I was in medical school, and I was I was homeschooling my children. I was single. I had 3 kids. And I was going to college and medical school. Every time I sat down, I went to sleep. I was busy, and I loved what I was doing. I wasn't super stressed, but I was and I slept. I've always slept. I was just incredibly busy. So, and I don't do that anymore. I can't even take a nap in the daytime now.
Maybe she's interpreting that relax.
Yeah, and she might be doing those micro sleep, but she's sleeping at night, so yeah.
I think it's narcolepsy. She doesn't.
Yeah, that narcolepsy is actually a disease. It's actually a disease. I did not have narcolepsy. So
you were just tired.
There's
your body was like sleep.
Yeah, there's cataplexy and narcolepsy, and those are actual disorders. Okay. Anything else? All right.
So we were talking about amino acids back with the L-theanine, and you were saying that different amino acids can help. Do you have any insight on the fact that most people do not get enough protein in their diet? Do you think that you can get do you think that adequate protein, eating protein, would negate the need for?
Absolutely, and I always want people to get their substances from food.
Yeah.
And other,
So as long as I'm getting an adequate amount of protein, that's probably not an issue.
And I know I was vegetarian and vegan for 17 years, not completely vegan,
So-
and I didn't know better. And we did get healthier, which you will, because we weren't eating well before that. But I found out there were a lot of deficiencies by doing that, and now I don't teach that anymore. I will help people that are vegan and vegetarian try to do better or get some sources of what they need. But so I do think that if we don't, and the other problem is if we can't afford grass-fed meats and healthily raised meats, there's going to be things in the meat that we eat that keeps us from absorbing it properly, from it's just such a
And
big
it's just not a
picture.
better quality- It's not as good of a quality.
No,
meat.
it's not.
It's not there to begin with. So you
Right.
restrict it.
And they're going to those proteins are going to have some of these, but our gut could be, not correctly absorbing things, all kinds of reasons. But absolutely, I believe in getting the ones that we need to get from
I'm
proper
like running
sources.
through my checklist of freshmen that I'm helping with this, and I'm like,
Yeah.
he does all of these things, but that is one that I've been yelling at him forever to do. So
Yeah.
If you-
And I didn't do everything there is to do on sleep, but this is like it's getting close to what I know.